how do I make my med school application stand out? What's the purpose? We always like to talk about the purpose of every part of the application process. The purpose of the written application document, well, first and foremost, are you mature and professional? You know, because med school is not going to teach you maturity and professionalism. Yeah, there's topics and courses on ethics, but more or less, hey, are you mature professional? Then if yes, come on in and we'll teach you the science and the art and science of medicine. Otherwise, no thanks, maybe another time. In case you've never seen any of our past events, my name is Beruz Momeni. I'm the CEO and founder here at BeMo. I'd like to introduce you to Meng, who is our manager of consulting department. Very importantly, communication skills, specifically written communication skills. Like imagine you're a medical doctor and you can communicate with others via really good, concise written communication skills, because sometimes, you know, it's not just verbal. Verbal is important, that gets assessed during interviews mostly. But written is important as well, because you're going to communicate with a lot of different people of different skills as a medical doctor via written format as well. So it's very important. So the other thing is, do you have the essential qualities? You know, for example, the core competencies by AAMC, or you know, the CAN-METS if you're applying in Canada. Again, that's why I'm saying, you know, whether you're applying US or Canada, it doesn't matter. Just pay attention to these, because and the qualities are very similar either way, no matter which part of the world you're trying to be a doctor. Your goal in the written application document is writing fantastic essays, applications, etc., that highlight some of those essential qualities.
I think definitely empathy is an important quality that could be shown in your application through an example. Another one might be your ability to problem solve, scientific inquiry, all those kinds of things. And you know, without listing all of them because there are so many, I guess I can guide you, direct you to where you can find a more comprehensive list. One place is you can look online for the AAMC list of core competencies for pre-med students if you're applying to schools in the States. Oftentimes schools themselves will list competencies that they're looking for, and you can really think about what competencies you could show in your written application. That's certainly true of Canadian schools, but also US schools. If you look at the online database with all the requirement information for all the schools, there's a section called selection factors, and it often will tell you what kinds of competencies they're looking for specifically in their candidates. And I would encourage you to go and do that research to make sure that you're displaying these in your application.
Exactly. And you know, a lot of these are important, and we're going to discuss them, and we're going to even tell you how you should highlight them and how you should not. For example, I'm going to tell you, you cannot write a personal statement and say, I'm a great leader, I'm a great researcher, I'm a great scientist, I'm a great you cannot do that. You cannot just highlight adjectives for yourself. That's not showing evidence. When we say evidence, you gotta have, you gotta learn how to say this by telling stories and your experiences, and let the admission officers essentially pick and select that. You got that quality. Yes, you got that quality. You got leadership. You got that. So that's important. That's one of those things when we talk about, when we say, you know, show, don't tell, for example. So the other part of this is, will other professionals back up your stories? People who write your letters of recommendation, your referees, your verifiers. And most importantly, what makes you stand out from the other, I don't know, gazillion applicants we got this year? Why should I have 30 seconds to read your application. Go. You have 5 seconds to convince me that, you know what, I should continue reading, or I should put you in the rejection pile. So those are the things that you should be thinking about. And, you know, I'm actually going to tell you about a couple of hidden, not, you know, it's not in the core competencies of any professional body, but you have to show that you're detail oriented. So nothing irks an admission officer or somebody to see that, oh my God, you missed this part, you have a typo, grammar is off, oh my God, like one sentence is missing. Like, you cannot do that. That doesn't show. Because imagine, as a medical doctor, you forget things. You're not conscientious enough. So that's really important. The other thing is they want to see if you plan really meticulously. A personal statement or an essay or list of activities that was written yesterday versus one that was written over weeks or sometimes months, the quality is day and night for the same person, same exact experiences. We've seen that so many times because we work with our students for like sometimes weeks and months, depending on when they sign up for the program. So that's why people, admission officers are, very impatient because they not only that they don't have a lot of time and a lot of, on the other hand, they have a lot of applicants, but the minute they notice you have these other qualities that are just common sense, they're not going to give you a chance. And they shouldn't. Think about it. Do you want a medical doctor who doesn't plan? For example, they're going to do a heart surgery. I mean, of course, in cases of emergencies, but even then, they have planned. They have practiced the profession. They've gone through courses. They've done residencies for years. And then you have somebody sends an application like that. It's going to immediately end up in the rejection pile. So pay attention to these things. So what are the top 5 reasons that most applicants get rejected? We kind of talked about it. Starting applications too late, applying to inappropriate schools. It's like you don't want to apply to schools where you don't have a realistic chance of getting in. Example, you don't meet their GPA and MCAT requirements or their average stats. You don't have the courses. You don't have the right experiences. Do not apply to those schools, period. Yes, you want to apply to a decent number of schools to increase your chances, but not to schools where you have like 0 or close to 0 chances of getting in, because they gonna really consume your time and are gonna really hurt your chances, because now they take attention away from schools where you do have a chance. Including inappropriate experiences that don't show commitment and progression. So inappropriate, there's multiple ways to explain inappropriate, and we've seen all sorts of different kinds of experiences that shouldn't be in a medical school application. But I'll focus on progression and commitment, because a common mistake is you see an application, and when we do our application reviews with our students, we put our hat on as in, hey, let's assume I was an admission officer. So what am I looking for? And let's assume that this person is going to become my future medical doctor. And you've heard the saying, actions speak louder than words. So if you're putting a gazillion experiences and they're all like, I did this for 2 days, I did that for 1 week, that doesn't make any sense. It's not meaningful. It looks like you're just stuffing stuff in your application. And everybody knows that. You may think like, oh my God, it looks so good. I got so many experiences. No, not if they don't show commitment. Not if it's like something you did for a month or a couple of weeks. Secondly, you want to choose experiences that show progression. So what I like to see is I like to see somebody, I do that, for example, even when I'm selecting, let's say, as the founder and CEO at BeMo, I'm selecting applicants who want to come work with us for different roles. Same process here is, you want to look at, see if somebody says, I am interested to do such and such. Okay, show me evidence that you did things related to that thing that you're telling me you like, and you kept being committed to it. So you did it maybe for years, or at least for several months, and you kept getting better. That's what I mean by progression. Let's say you started you couldn't get a research position on your first year of undergraduate studies. You said, hey, can I come and volunteer? So you have that in the same laboratory, volunteer, first summer. Then during school, they recognized that I was doing well. They gave me some other project to help a graduate student. Then after that, I got my own project. Then after that, I did a presentation on my own. After that, I published my results. That's progression, and this person was serious. That's what I mean. So choose those and be very selective. Not answering the questions being asked is, you get an essay and they say, here's a question, and you try to be a politician and not really answer the question. I think this might become a little bit clear once we do some examples and you see what we mean. And lastly, but not least, if you cannot write coherently and demonstrate without doubt that you could communicate really well in written format in an application document, you just have no chance. Again, it doesn't mean you gotta write like Shakespeare or it has to be fancy language, but it has to be coherent. You should have great spelling, you should have great flow, you should have great grammar, and the beginning should tell me what's coming and the end should wrap it all up. And we're going to talk about all of that. And this is a major challenge for a lot of students because, like we said, pre-meds don't traditionally take English courses, history, humanities, all the good things that you actually need, not only to be a good doctor, but also complete this application. So this is a struggle, but there's an easy fix to it if you put in the time and effort.